discusses issues in education continues, and our next panel includes Dr. Kim Ratcliffe, Associate Executive Director for Student Services of the Missouri School Boards Association, Dr. Jacque Cowerd, the Superintendent of Fulton School District, and Dr. Art McCoy, Superintendent of Jennings School District. Welcome, all of you.
Thank you.
Thank you.
Thank you very much.
Thanks so much for being with us. And I want to talk first of all about the importance of schools meeting health and mental health needs of students. This is something that, again, has become more and more an issue, and we're starting to see school boards respond to it across the state. So what are those issues?
Well, I think there's a number of issues, and we know that they're tied very closely to student achievement and to lifetime outcomes, and that's why schools are more involved in it today than they have been, that there are unmet needs. Children don't have access to health services that they require, and so districts are looking for ways to respond. Jacque's district and Art's are both investigating that. Art is into it a little bit more, and Art, you might speak to that.
Sure. I mean, the needs vary from just needing traditional doctor's visits type immunizations to needing more therapeutic services, routine work that insurance, they may not have insurance for. So, I mean, we have 2 health-based clinics in our school district that services every child from pre-K through high school for every immunization, as well as vision, dental, and therapeutic services, 2 therapists per school. We try to be a trauma-informed school district, so that means that we deal with the trauma that the families may face within their home and throughout the broader community. So we definitely make sure they get all the
So, Dr. McCoy, does that change any way the role of the nurse, their traditional role?
For sure.
Does that add other experts into the staff?
Yes, it empowers the nurse so that they have a team of physicians that are like next door to them to then immediately refer the child, and then that increases your daily attendance. I mean, we have an average of 97% daily attendance, and it basically services the children's needs.
And I wondered, Dr. Cowerd, maybe you can speak to this as well. The physicality of it. When we're talking, when I was in school, it was about ramps. Hey, we have ramps. Look how great we are. Yeah. But the physical needs have changed for the schools as well. What are the new things that are needed?
Well, the ramps are still a big issue, elevators and multi-story buildings. But also the more critical issue for us is paraprofessionals to help assist these students, because typically if they have a physical disability, there's some other related factors. And that gets to as Dr. McCoy said, the social emotional pieces and working through that. And a lot of times when you look at a child that's had a couple of disability type factors, there's disabilities rampant in that home. And we're trying to reach out and figure out those pieces so that when that child comes to school in the morning, we have a good experience walking. Well, I tell my bus drivers, they have a good experience on the bus, then walk in the door, because they don't do well if they're not happy to start with.
Indeed. And so talk about the steps that the schools are taking to make sure that they're up to date as much as they can be from year to year.
Well, we do our ADA compliance checks every year, and the federal government has a pretty significant step. We try to kind of look at little things, and this next year we're going to really focus on sidewalks, entrances, and eliminate those physical barriers to wheelchairs and people walking with crutches or disabilities. And that doesn't seem like a lot to me, but I was on crutches for a couple weeks with a knee problem, and it's a real experience when you go through and try to get up those stairs and try to work through that. And then other little things, just I always like to walk in and see clean floors, and clean floors are slick floors. And maybe we have to look at how we're doing some of those things, too.
You dirty up the floors a little bit.
Well, yeah, that didn't work too well.
and Dr. Ratcliffe, talk about some of the services schools are now expected to provide, because we have kids now who have medications that they take every day. There are all kinds of things that, again, we didn't see as much maybe 20 or 30 years ago.
Well, that's very true. And I think to understand the context that schools from 1975, when there was the Individuals with Disabilities Education Act was passed. It was called something different then, but it was reauthorized, and that's how people know that term today, that this basically says that every child has access to school, and we have to do whatever it takes to allow that child to access school. And so when you consider that, then you have to start considering what are the barriers. And today, one of the biggest things that we're seeing is mental health issues. And that is a very challenging issue to deal with because you have community perception, you have stigmas attached to that. And as we try to destigmatize that and to look for the kinds of support services that children need so that they feel safe, so that they come emotionally and mentally ready to learn, has been an increasing challenge. But it also means that medication management, and that's a huge thing for nurses anymore.
Exactly.
And a lot of their time is taking care of that. And when you look at the degree of chronic conditions that children now have, from asthma, bipolar disorder, you have things like type 2 diabetes, you have children with mental health issues that require medication. There's just the whole gamut there, and we want all of those children to be in our schools and to be successful in our schools, but the supports have increased sort of exponentially as we welcome every child into school and want them to be successful.
I want to elaborate on some of those supports. So,
Please.
For instance, we've purchased vehicles, minivans, to have shuttles back and forth to our 2 health-based clinics that services all 8 of our schools. That's 1. 2, we have asthma vans that go school to school to do monthly asthma checks, monthly advice to students and families about how to regulate their home environment, but also the right medications. In addition, we have nurses as newborns, nurses for newborns. So that means that every mother with a newborn child gets a social worker and a mentor parent that does a home visit. We have health-based, in addition to the health-based clinics, we have food giveaways, we have grocery giveaways, cooking classes, because a lot of it is how you regulate your diet as it pertains to diabetes and other things. So we offer those services to parents and to students and give free groceries weekly to them so they can regulate their food, because sometimes it's a food desert, a vegetable desert situation in certain parts of the urban environment.
Sure.
So there's just tons of additional new methods that lead towards a whole holistic, whole wellness environment. We have peace rooms and comfort rooms in every school that includes a washer and a dryer, but not only that, it includes a therapeutically healing environment, like a kind of a spa kind of music thing, and not sensory overkill like most people have, too much technology in front of them, too many hours on the screen. So we're desensitizing, or we're sensitive to those things, and they're often desensitized to what's in their environment, so we're showing them the alternatives that allow them to regulate their own home
Well, we're going to be talking a little later in this segment about safe schools. So how does the mental health kind of cross over into the whole idea of creating safe learning environments where all can learn and teachers can teach?
Well, we're doing similar things to what Dr. McCoy was referring to, and trying to get our buildings up to speed on all those issues. Another factor in a lot of that issue is that bringing your staff along. When you refer back to last 20 years, well, 20 years ago, I think most of us remember Grandma in as a school nurse. Well, that's not acceptable anymore. We're looking at RNs and professionals, and that's implied in some of the things he was talking about, but that's when you get in our community, it was a new culture. Say, yeah, we need nurses, we need to do these things and make those connections. And then it also comes back to the community to support buildings, funding. 10 years ago, 15 years ago, you'd add a trailer to help that classroom out, and that's just not a safety issue. That's a safety issue now. You're just not going to do that. So it's a funding issue to come back and start looking at those pieces.
Well, it's interesting. As we're designing schools, today's school is not like yesterday's schools.
That's right.
And to collaborate with the teachers in terms of their role and responsibilities throughout the day, the nurse, the principal, engage the parents, it's a different setting. It is not the same.
I suspect you're doing a lot of smaller conference rooms in schools as opposed to the multi-classroom space with conference areas or privacy areas for therapy-type
just
services.
Like Dr. McCoy said, those comfort areas.
That's right.
I would think maybe 5-10 years ago that they were called timeout rooms. They're not called that anymore.
They're not that anymore.
Different world. Well, and it seems like, too, that this is a place where a strong school board is an important thing, because you don't want to get into a situation where the school is expected to become a healthcare provider. Right. Schools still aren't doctors. So there's a difference between support and that. So
Definitely.
How do you keep those lines from blurring?
Yeah, I applaud the Jennings School District Board for having the courage to understand that there are needs and that we should partner with the experts to have these collaborative new innovations so that we are not the sole owners of or responsible agents to do, but that Children's Hospital is our main partner. BJC is a main partner. Express Scripts even hires our students as lab technicians. We have a CNA program. So it's a very kind of home-based, grow your own nurses from the student level up, hire your own employees that live in the region to let them have a living wage in addition to good living habits. But our board started with this focus of collaboration with the experts to incentivize and support the community. That's key.
Which brings us right into funding. So talk a little bit about Medicaid and how organizations like that work into making schools a healthier environment.
Before I know I'm going to let my colleagues start on that, but you asked a question that was important about Safe Schools Act. Mental health cannot be overemphasized. And by having people on site to do homicidal, suicidal, even investigations / assessments for students and our staff is just a safety mechanism that we've never had before. But let me give you an anecdotal story real quickly. A teacher saw a student in class, Mrs. Warren. She just wasn't looking like herself. She said, "You need to go to the nurse." The nurse said, "I don't know what's going on." Sent her to the spot clinic where we have a physician on staff. They did the assessment on the spot because they had permission to do what an outside agency would normally do. And unfortunately, the girl was off the charts with suicidal tendencies. She was hospitalized for that following week, and she came back to school and was better. But she said, "I was going to kill myself," and had not articulated it. So it's that real-time availability for mental health that is crucial in today's society.
Well, when I'm in schools, I'm in a lot of schools, I see the teachers always observing the kids, the eye contact that the teachers have on the students, and then as we design new schools, there's plenty of glass, there's no hiding place. These kids are observed continuously from the time they walk in the door to throughout the day. So just like you said.
Saving lives.
When you get outstate, it's a little more difficult to bring those connections. And the school is going to have to become more of a mental health provider because we just don't have the resources or the folks in the community that can partner like what Dr. McCoy's district has. And we're looking to add those kind of staff members to make those connections. And we see our major focus coming in the next couple of years with, I don't know whether they're social workers or more nurses or counselors. We're looking for people that can make those connections because sometimes we have to get people out of our community to surrounding communities, and that mileage may be the same as in St. Louis going across the street, but when you break outside of a defined community outstate, it's a little different perception, I think, and kind of work through that.
Right.
And I think, Dennis, you're absolutely right on our teachers. Our teachers have had so much training with various, whether it's dyslexia, suicide prevention, bullying. It seems to be coming out of their ears at times, but they're good at identifying issues. We just don't have enough people to start dealing with the issues when the kids get lined up outside the office or in the hallway or wherever that is in the nurse's office.
Right. So then to get back to it, how much leaning on agencies like Medicaid do you end up doing?
Well, actually, Medicaid is a huge part of funding the medical services under IDEA to begin with. There's actual federal law that makes that connection and says it's the payer of first resort for medical services if a child is otherwise eligible. And it's wonderful because we need to provide those. I was the director of special ed in Columbia for a number of years. We had children on full life support coming to school, and that involved pretty intensive nursing. But from one perspective, to normalize the lives of those young people and to help them to be surrounded by peers and to be learning and making their lives productive for whatever period of time they had was the right thing to do, and it was a wonderful thing that we could do, but it took a lot of medical services. Medical services are very expensive services, and there's one pot of money.
That's right.
If I'm not right about that, you tell me.
Right.
And so to be able to have Medicaid when a child is eligible, to be able to fund those medical services. And that's something that MSBA has worked very hard to do, is to advocate for additional services. We now can look for assistance through billing Medicaid for occupational therapy, physical therapy, speech language, private duty nursing, which is one-on-one nursing, personal care attendants when a child needs a personal care attendant all day with them, for toileting, diapering, tube feeding, whatever it might be, and mental health services. And we have partnered with our departments of state, be them the Department of Mental Health, Department of Social Services, where MoHealthNet, which is what Medicaid is called in this state, is under. And as we've worked with those departments and Department of Health and Senior Services, which works with school nurses, we have been able to get this fabulous response from those agencies to say, we're better together. There's a great synergy going on now to look at what we can do to further support and sustain long-term health care, meeting the health care needs of our children in this state. And I can't say enough about the cooperation and the vision we have for that.
As a superintendent, I just can't thank Kim Ratcliffe enough, Dr. Ratcliffe, seriously, because in addition to all that, which is 100% true, she's an advocate, and the agency, MSBA, is an advocate for students first. They have a task force that brings together all these agencies and the schools to inform, educate, get feedback, real-time feedback, and then advocate for more dollars, more help, more knowledge, and national networking. The national network aspect of bringing other experts from other states to come in and say, this is how you do it best. That's under the leadership of this organization and this great person sitting next to me.
Well, Dr. Kim Ratcliffe, Associate Executive Director.